All right, today we are putting on our detective hats. We're going to dive into a fascinating medical mystery, piece together all the clues, look at the suspects, and solve the case of a really serious, but thankfully rare, condition called Chiari syndrome.
So, to get started, let me just ask you this. What do you think happens when your liver, which is, one of the busiest, hardest working organs in your entire body, suddenly gets caught in a massive gridlock traffic jam? That one idea, that single analogy, is really the key to understanding this entire story.
And here we have it, the formal definition. Chiari syndrome is exactly that, a blockage of the hepatic veins. Now think of these veins as the main exit ramps for blood trying to leave the liver. So blood can get in, no problem, but it has no way to get out. And what happens next? A huge backup, right? This creates incredible pressure and congestion, and the liver itself really starts to suffer.
So, how do we even know this internal traffic jam is happening? What are the first signs? Let's take a look at the initial clues that start popping up.
Well, any good medical detective is going to look for what we call the classic triad. It's three main symptoms showing up together. First, you've got abdominal pain. Then, ascites. That's just a buildup of fluid that makes the belly swell up. And finally, a tender, enlarged liver. You see those three things together? That is a major, major red flag.
Now here's a really sharp detective move. This is a crucial clue that helps us rule out another big suspect, right-sided heart failure. See, with heart failure, the blood backs up from the heart, which causes the veins in your neck to bulge out. But with Chiari, the traffic jam is downstream, inside the liver, so you won't see those bulging neck veins. It's a critical piece of evidence that points us in the right direction.
And if we could look even deeper, our investigators would find another telltale sign. The intense congestion inside the liver creates this very distinct pattern that's called a nutmeg liver. And yeah, it actually looks kind of like the spice. This speckled appearance is a direct result of all the damage being caused by that internal gridlock.
Okay, so we've gathered the first clues. It's time to bring in the high-tech gear. Let's move on to the diagnostic toolkit and see how we can actually confirm our suspicions and crack this case wide open.
The path to getting a definitive diagnosis is actually pretty clear. Step 1 is a Doppler ultrasound. It's the perfect tool for literally seeing blood flow, or in this case, the lack of blood flow. It can spot any blockages in those hepatic veins right away. Now, if the picture's not 100% clear, the next step is to get a CT scan or an MRI for a much more detailed view.
But here's the thing. During that ultrasound, there is one specific clue that is so definitive it's considered pathognomonic. That's a fancy word that basically means if you see this, you have solved the case. It's the smoking gun. And that finding is the hypertrophy or enlargement of one specific part of the liver called the caudate lobe.
Now hold on a second. That seems totally backwards, right? The rest of the liver is congested, it's damaged, it's in big trouble. So why on earth would one little part of it actually be getting bigger? It's a fantastic question, and it leads to the big reveal.
And here is the absolutely brilliant answer. It turns out the caudate lobe has its own private VIP exit ramp. It has a separate little vein that drains its blood directly into the body's main highway, the inferior vena cava. So, while the rest of the liver is stuck in that horrible traffic jam, the caudate lobe is just bypassing the blockage completely. It gets everything it needs not just to survive, but to thrive and actually grow larger. Amazing, right?
Okay, so we know what's happening, and we know how to spot it. But our detective story isn't over just yet. We need to figure out why it happened in the first place. So it's time to unmask the cause and take a look at the usual suspects.
This chart breaks it down perfectly. The #1 cause of Chiari syndrome, by a long shot, is something called a hypercoagulable state. That just means a condition that makes your blood way too likely to form clots. And the prime suspect, responsible for about 40% of all cases, is a blood condition called polycythemia vera.
And here's a look at the whole lineup. Besides polycythemia vera, you've got genetic conditions like factor V Leiden, autoimmune problems like antiphospholipid syndrome, even things like pregnancy or taking oral contraceptives can increase that clotting risk. So the really crucial takeaway here is this. The problem usually doesn't start in the liver at all. It starts with the blood itself.
All right, we've identified the cause. Now we can finally move to the last phase of our investigation, clearing that blockage and fixing the problem. So here's the plan of attack.
The treatment plan is super logical. It follows this clear, escalating ladder. Step 1, for pretty much everyone, is anticoagulation. You use blood thinners to try and dissolve the clots that are there and stop new ones from forming. If that's not enough, doctors can go in and physically open the vein with a balloon or a stent.
If that still doesn't work, they can create a whole new route for the blood with a procedure called a TIPS shunt. And then, the final option, if the liver is just too far gone, is a liver transplant.
Now, check this out. This is a really important clinical point that honestly surprises a lot of people. Patients with Chiari often develop these swollen veins in their esophagus called varices, which are at risk of bleeding. So you'd think giving them blood thinners would be a terrible idea, right? Well, it's not. It turns out the benefit of clearing that clot in the liver is so massive that you give the anticoagulants anyway. That is a vital, life-saving point to remember.
But even after the immediate danger is over and the blockage is cleared, the case isn't fully closed. We need to look at the long road ahead because there can be some serious complications down the line. See, that initial traffic jam can set off a domino effect. It pretty much always leads to high blood pressure in the liver's blood vessels. That's called portal hypertension. From there, things can get worse. It can progress to permanent scarring, which is cirrhosis, then to acute liver failure, and it even increases the long-term risk of developing liver cancer.
And all of this just hammers home the ultimate lesson from our investigation today. When it comes to Chiari syndrome, time is absolutely everything. Spotting those clues early and acting aggressively to clear that traffic jam is the only way to save the liver before the damage becomes permanent and irreversible.
So, I'll leave you with this final thought. We spent this whole time talking about a liver problem, but what did we learn? We learned the cause is almost always a blood problem. It really makes you wonder, is the ultimate key to preventing this kind of liver failure found not in the liver at all, but in managing the conditions that cause those clots in the first place? It's a great question that really shows just how interconnected everything in our bodies truly is. Thanks for joining me on this case.